All right, good afternoon, everyone. A very warm welcome to all of you joining us today for this enlightening session hosted by Homeopathy 360. I'm Dr. Noori, Senior Editor at BJ and Publishers. It gives me immense pleasure to announce the launch of Organon Masterclass 2025 on Homeopathy 360, specially curated to bring you insightful discussions and expert interpretations from some of the most respected masters and teachers in the homeopathic world. I'm honored to welcome our esteemed speaker of the day, a highly respected homeopath, educator, author who is known for his work, Dr. Pankaj Aggarwal. Sir has been practicing homeopathy for over 33 years in Delhi, and he has taught Organon of Medicine for 23 long years. He is former professor and HOD, Organon of Medicine at NHMC Agra. He has been awarded Homeopathy Gem Award in 2012, Homeopathy Par Excellence Award 2013, Dr. D.P. Rastogi Award in 2014. He was honored with Excellence in Homeopathy Award by CCRH in 2018 for his outstanding clinical work and commitment to teaching. Also, he has received the Lifetime Achievement Award from Progressive Homeopathic Society in 2021, acknowledging over 3 decades of unwavering service to the profession. In today's session, Sir will be sharing his insights on Organon in practice and research, as well as share his latest work on the book Spirit of the Organon by Dr. T.C. Mandal. Sir, we are absolutely delighted to have you with us today. Sir,
Thank you so much. I think I'm audible now.
yes, sir.
Yeah, please. So,
So,
should I start with my presentation?
absolutely, sir. While Sir is sharing his presentation, a quick note for the audience. If you have any questions, please drop in the Q&A box and we'll take them in the end. So the digital stage is all yours, sir.
Okay, thank you. So, just allow me a minute to share my screen. Uh, I think my screen is audible to everyone now.
Yes, we can see that. Yes, sir.
So, all this technical kind of things, we still have to depend on some experts. So, thanks to Dr. Saleha Aggarwal for really helping me to go ahead with this technical thing. And hello, viewers. I think my presentation and my voice is now very loud and clear to every one of you. Please write me yes.
Sir, you are very audible.
Okay. So let us go ahead with the presentation straight away. So the first and very important thing is nowadays mm, it's a good time around the world. People are now talking about Organon of Medicine. There was a time when I used to hear that in the other side of the globe, Europe, America, everywhere, when they talk about homeopathy, they do not want this book, Organon of Medicine. I used to be surprised, but very good in India. It is very well taken. It is a one proper subject in our curriculum, in MD, in graduation, even in PhD homeopathy. And I am really grateful that I studied from the very prestigious institute, National Institute of Homeopathy, Kolkata, where I happened to meet and sit in the feet of the uh, great masters of Organon, like Dr. R.R. Jordhar, Dr. Ellen Khan sir, and many more such people. And really thankful to BGen organization and the publication that they gave me the opportunity to go through the book of, the author is Dr. Mandal, and I'm really thankful that he is a very good colleague and very good friend of mine, Dr. Mandal, and he came up with a very tedious and very difficult job of coming up with the book. So the thing is that what's the reason that I want to take up this subject, Organon in practice and research? So we call Organon of Medicine a magnum opus, such a book which is magnificent, everything, everything, everything. Why? Because the first ever book in the history of medicine, which came up with the methodology and practice as well as research in medical art in a Renaissance period, and that especially the 1810 to 43, all the six editions, were penned down by Master Hahnemann. Five were in the hand, and the sixth one came 1921 in the book form, but then it was very well penned down by Master. So, sorry. You know, mostly we say in the classroom, in the seminar, in our discussions, homeopathy is an art and science. So I changed this, last part of the sentence, that homeopathy is an art which lacks its science. But if you really see the real truth behind the science of medical science as a journal, in journal, the medical science is universally lacking. Let us just take few examples for that. Like, what do you think? How all the five senses of the human being, how does they work? Do we really know? Actually, not. When it comes that if you're seeing me and you're listening, but do you really know how the brain is copying this visual and how this ears are copying this voice of mine? Actually, we do not know. And there are very, very specific other kind of things regarding the senses we do not know. Some people will say, my yellow color. Everybody has their specific choice of a particular color, the hue of the color. How it is determined, we actually do not know. Then finally, infection is a very well-known word and very well, simplified by Louis Pasteur. But actually, it is not that simple. We are not really knowing how we get infection and how we get rid of it. The whole cascade reaction, there is one step, finally, we do not know. Then almost every practice of medicine book, if you talk about the chronic diseases, you can name them as non-communicable chronic diseases. The cause behind them is idiopathic. I can remember with this word my professor Dr. D. Paul in NIH Kolkata, he used to say, do you understand the meaning of the idiopathic? He used to teach us. Idiopathic means that physician is idiotic to know the cause. So, these are the three very big examples. Every one of us, whether the newly uh, student who came up in the medicine, or the one like me who is like 30 years, 35 years in the practice. So just imagine that how all this about. So what I would like to say, that practice of medicine is a medical art, and Organon of Medicine is such a self-sufficient book to really handle every kind of case. So I would say that if we really focus on the Organon of Medicine, this should be like, one handy book on our consultation table. And uh, if you really see that every time when you want to find out what is the next step to be done. Organon is a book that we can very well refer it and decide the next step for all of us. So, this is when I say Organon of Medicine is the first book. You may ask, are you sure? And how can you say so? See, if you go into the Organon of Medicine fourth edition introduction written by Dr. Samuel Hahnemann, the review of the therapeutics, allopathy, and palliative treatment that have hitherto been practiced in the old school of medicine. It is the 30 pages introduction. Just imagine, author like Samuel Hahnemann and writing an introduction, such a long 30 pages introduction of that book. So he just threadbared every point, every kind of treatment. Those all were in the vogue those days, you know. And I just give you some examples out of it, that what kind of treatments were in vogue those days. Before just going to the example, you can just see the introduction. We can divide it very well into review of therapeutics, all the explanations, criticisms of the prevailing systems, number of prevailing systems of medicine, uh, which is given, in almost 1 to 27 pages. And he has given certain examples of practice of homeopathy, but in a very unconscious manner. Nobody was knowing what exactly, uh, whether are they practicing homeopathy, are they practicing the law of similia. You know, the homeopathy word, Hahnemann gave this method of prescribing, in 1808. Before that, he named this system as specific remedy. Hahnemann never wanted that it should be a completely a new system. He wanted that it should be the only system to be practiced in the medical world. But somehow it never happened. And thereafter, so he named it as homeopathy. And in this introduction, he has given certain examples of people, those who were not really medical doctors, but they were using the law of similia. And he has later, at the last page of the introduction, he has given some 7 examples of those days very, very well qualified physicians, those who actually understood the law of similia, practiced law of similia, and advocated law of similia. So let's have certain examples of the non-homeopathic kind of treatment. Like, for example, somebody is suffering with piles. So the nature, the vital force, for whatever may be the pathology, because there was veins in the rectum area, they were engorged, so bleeding started. So some understood that this is the treatment. They did not understand this is not a treatment. This is a symptom of something wrong happened. So what they did, they took a cue from it and they followed the nature, minister naturi. Be minister, be servant to the nature. Minister means servant. Be servant to the nature, and they applied leeches. Another example, the diseased vital force endeavored to subdue the violence of dangerous internal malady by evacuating blood by means of vomiting. Somebody, suffering with something, so a lot of vomiting and coughing, and with that, the blood comes out. And again, to follow the nature, deus naturae. So what they did, they started copious venesection. You all are aware in your graduate, postgraduate classes, that what kind of treatment was going on. Venesection. Somebody is suffering with pneumonia, so doctor, the very very well known, very tall name doctor coming and saying, okay, fever is less, patient is looking better, all right. 250 ml of blood thrice a day may be removed by venesection. That was the treatment, because they thought inflammation they did not understood those days. They felt the nature is trying to push out the blood. So they said, okay, let us help the nature. That is why, such treatment developed. So another example is, because of some of the reasons, there was nausea. So what they started using certain powerful medical substances which can induce vomiting, powerful emetics. They used to give evacuation medicines so that a proper cleaning of the stomach, if you talk the Ayurveda literature, they have so many things, something like this to be told that as पेट साफ करने वाली दवा. One to add is also come, पेट safa. So another example is that the vital force, in order to relieve the internal malady, sometimes produce indolent enlargement of the external gland, and he, in his assumed character of servant, by the use of all sorts of heating, ambrocations and plaster. Even now such condition comes, boil comes up, certain kind of corns come up. So we have corn cap. What is that corn cap doing? It is just going to create a inflammation and remove it. It's a belladonna plaster. So like that, it was the main treatment in those time when Hahnemann was working on all this. So there are the certain examples I quoted in the introduction. If you go of the Organon, it is full of such example in a very, very proper manner. You can understand what exactly the method of treatment, what was the theory behind according to the propagator of that, and Hahnemann told that how it is futile and how it is harmful to the human being. So what we understand is that every practitioner who is using Organon of Medicine, I hope you're able to see the book. But that everyone who is practicing does not mean that they are not using Organon of Medicine. But my question is, how cautiously are you using it? Let us take, certain examples. What actually we do in practice. Every one of us, when we are seeing the patient, our first and foremost function is case perceiving. Thereafter, we analyze, we evaluate, and thereafter we go for the prescription. Prescription has three components, very, very important thing. Selection of the remedy, selection of the potency, and selection of the dose. When I say selection of the dose, it has two things: quantum of the medicine at a time to be given, and its repetition if required. So for every such thing, and the last thing is follow up and follow up and follow up. For every such thing, there is a proper aphorism devoted, a group of aphorism devoted. Proper criteria is very well explained. Uh, Case perceiving. I told aphorism 3, 6, 7. We all know for the case taking, the best aphorisms and the only aphorisms are 82 to 104. No, not really. You know, if you understand Organon, doctrinal part, practical part. So for every topic, there are aphorisms in the doctrinal part, the conceptual part, and aphorisms in the practical part, that how to apply it. What is to be applied is the doctrinal part. How it is to be applied, the practical part. So for everything you will get aphorisms here and there. So I just quoted certain aphorism numbers here to sensitize you, to remind you that all these things are very, very important to understand. Every time if you refer, you will be able to you know correct yourself. You will be able to improve upon whatever we are doing, and finally you will be able to be in practice of doing prescribing and follow up as per the Organon. And when you do this, Out of that, actually, the research point comes out. That is how Hahnemann has worked, and he worked of 1810, the first edition of the Organon, 1819, the second edition of the Organon, 1824, the third edition of the Organon, 1829, fourth edition, and 1833, the fifth edition. And he did not stop at his age more than 75, and he's been working, and he came out with the sixth edition. You understand, 50 millisiemens potency. That is the last gift to all of us by Master Hahnemann. But somehow, because of whatever may be the reasons, that book came to all of us to use in practice in 1921. So every one of us are using Organon, but we really lack that consciousness. So the idea of this presentation today is that you be conscious about the various aphorisms. Like, I just give one elaboration out of these aphorisms regarding the case proceeding. You see, aphorism 6. He says the medical observer. He's not saying physician. He's saying observer. When a patient comes to you, you are an observer. You just listen to him and take note of nothing. It is the exact verbatim words from the aphorism. Take note of nothing except the changes from the health to the sick. Means you talk and talk to the patient, first of all, reach to the point where was he healthy and when he started getting ill. That boundary you have to finally draw while you are going to start the case taking, and then you start noting down whatever may be the changes occurring in his mind and body. That is what is the first purpose. And who is all going to tell you about all this? Patient himself, and very valuable. The family members, servants, or the observer around him. And the third one is yourself as a physician. When you examine, you observe, you note it down about many things when you are seeing a patient. So that gives a complete data, and that is called the portrait of disease. Now, aphorism 7 starts with the word now. Now, what to do with this portrait of
Sir,
the disease? Can you hear me?
sir, sorry to interrupt, but we cannot see aphorism 6 and 7 if you are showing that. Can you please check?
No, I'm just written the number. I'm not showing the aphorism as a whole,
All right.
right?
All
It is
right, sir.
just
All
number.
right.
I'm not showing the aphorism. Everybody knows. I'm just going to start with the cases. I'm just giving just initial introduction. So in aphorism 7, you can all refer your books. Uh, Starts with the word now. Out of this portrait, you remove all those symptoms which are because of some exciting causes and maintaining causes. The remaining lot of symptom is actually the totality of symptoms. The portrait of the disease and the totality of symptoms, they are two different things. You know, so when you get the totality of symptoms, that is what is called the final evaluation, and then you can prescribe on that symptoms, because a remedy which should cover all those points which you have drawn out of the portrait, that is the totality, and that is what is going to be the remedy. So this is the one aspect I told you in case taking. We all are doing, and we all have our own methodology. I would urge all of you to follow Hahnemann, because when I worked on the aphorisms of the organon, I understood Hahnemann has added any aphorism only after doing at least, or more than that, 10 years of proper understanding whatever he is writing. 10 years of proper, pilot study, you can say, in the name of research. So the rest is 82-104 comes how to do it, and all kind of methodology for case taking. Every one of you know it. But this is a very gray area of Homeopathy 6 and 7, which you all should know. Then comes the selection of the potency. Selection of the remedy. The selection of the remedy most important when a case is acute. The selection of the remedy aphorism guided is 152. When it is chronic condition, when it's a chronic case, then the aphorism which is going to guide you is aphorism 153. They're little long aphorisms, but I just give you the crux. When it is a acute case, you will find many prominent symptoms there. What you have to do is you have to choose the most striking symptom, maybe one or two, but the most striking symptoms. Mind my word, Hahnemann word actually. Striking means a symptom which is entering into your senses, maybe eyes, maybe ears, maybe touch. You're touching the patient of suffering with fever, and you touch and you say, oh my God, you are boiling, you are like hot, coal. It is such a hot heat, so prominent the heat. Only remedy is belladonna, nothing else. Because you have to match the most, mind the word most, and striking. So most striking feature and remedy, that's it. But when it comes to chronic condition, so it is 153. 153 is not PQRS, please, my dear friends. This we are not we're not going to do things in a mnemonics way. Mnemonics should not be the thing which will alter all the understanding. Hahnemann writes words in the Organon in order of preferences here in aphorism 153. The words are more striking, peculiar, uncommon. Like this, he has given all the four words here. So any symptom which is peculiar, but if it is not striking, it is useless. Any symptom which is uncommon, but if not really striking, no use of this symptom at all. So in chronic condition, symptom should be peculiar, uncommon, but at the same time, first of all, it should be striking. Striking means it should be persistent symptom. I'll just explain the case also. And when you go for the potency, potency is the hell of a job, in our practice of homeopathy. We have kind of many thoughts and views and opinions and the notions for choosing the potency. But I am thankful to my teachers, to my father, Dr. M. Aggarwal, that they taught me how to select a potency. And the key aphorism is 279. And the important thing is the what is the pathology, the extent of the pathology, and the area in which the organ in which the pathology is, how important that organ is. So first thing is the pathology in the organ as per its importance. Second is what kind of unhomeopathic treatment given. This is going to give us the clue about the sensitivity of the patient. More sensitive is the patient, higher is the potency, less is the sensitivity of the patient, lower is the potency. This is a thumb rule, and then rest we can go to many other philosophy books, and they are very well elaborated there. So when it comes to dose, aphorism 245 to 251, they just explain it. Long explanations required. I would request region organizers, when required, we can elaborate each of the aspects in the other next coming up of webinars. And now then comes the aphorisms for follow-up. You have done the selection, potency, everything, dispense the medicine given. Patient has, you have called patient after a week. Now what to do? Follow up. Aphorism 252 to 256 had been taught that how to observe the patient and what to observe in the patient so that you can really find out exactly really patient improved or not. And that improvement is in the right direction or in the wrong direction. So that is what is going to teach us. So that is how I really do that. So what exactly I'm going to do is I'm just taking up a case. Generally in Organon subject, it is generally criticized that these Organon people are only talking philosophy. No, that's not really my cup of tea. Whatever just now in last 10 minutes I spoke to you about the basic things of prescribing and all. I just want to show you in my case that is exactly I am doing it. One patient, 37-year-old lady, married, and she came to me for pain in the neck, and there was a pain also in the back. For 6 7 years it was there, and extension of the pain is there in the right arm, and aggravation in the evening, and better lying supine pressure, like this. So a lot of numbness of the right hand was there. You can make out with the symptom. A proper case of cervical spondylosis was there, along with the pain in the vortex, aggravating change of temperature, and what she is doing, just putting some balm on the head or inhaling the balm, tying that. If suppose you see that if patient is traveling and unable to eat well, so she will get that pain. So something like migraine kind of pain was there. In the if you go into the presenting complaint history, so she started with the some 6 7 years back. She started with the stiffness of her neck, and pain was gradual, on and off, and gradually it just kept on increasing. And later on, she became very much bad, and she started using collar as suggested by the orthopedician and neurologist. And in such condition, she came to. And what she did that because of somebody's suggestion, she, got them massaged very vigorously. And that has rather worsened the pain. You can understand any neurological issue, if you do some very brisk massage and everything, it just goes worse. And in the childhood, she was having that VSD, and also open heart surgery was done at the age of 5 years. She suffered with typhoid. She suffered with some eardrum issues, and some replacement of the drum was done. And then later she started suffering with endometriosis and going under the treatment for that also. A lot of allopathic history treatment and this and that I told you, and proper physiotherapy of ultrasound and IFT, everything was going on. Family history full of diabetes and mental illness, everything was there. So patient was actually the patient herself was a normally delivered baby, good weight, cried well and everything, milestones, everything okay. And she lived in a joint family since childhood, but at the age of 13 years, there was a family dispute of her father and his brother, which affected her studies, and she got failed in seventh class, which gave her a lot of insulted feeling. And in the year 2000, she got married, and after 2 months of her marriage, in a chain of number of accidents occurred in her in-laws family, due to which she felt that she is not getting a proper space, proper time. So she just made a feeling that she is having a fear of misfortune. Sometimes we say na, मेरी तो किस्मत ही खराब है. The most important observation by the physician is that her nose was very cold comparing with the forehead. It's a typical, uh, we name it as Montana positive, means Arnica Montana sign, we take it as, because the very prominent symptom, if you go into Mitrimetica pura, in the boric, in the Elinsky note, it's a very prominent symptom when forehead is warm and nose is cold, and sometimes fingers and toes are also cold. So that was very well there, and she was with the collar and everything, as I told you, appetite and everything. As we all go into the details of such things, we asked everything. And mentals, we asked that she was a very angry person, very easily angered. Any trifle, she starts shouting, all kind of phobias of height, water, always hurried, extremely impatient, coming to the clinic, doctor, just give me fast appointment, मेरे को जाना है, यहाँ पे बैठा नहीं जा रहा, like that. And very fastidious, everything has to be in order. And lot of feeling of insecurity and wants open air. So Gyneops history, it was all okay. I would request uh, BGN organizers, they can share my PPT to all the listeners and viewers so that they can go into the details in a proper way. And all this examination, general physics examination was also done. And it is something like before and after treatment, all the movements, they were all restricted. They started, very well, flexion, everything started moving very well in the patient. If you go into the analysis of symptoms and evaluation, that whole process was done, that what are the symptoms and everything, we have written down, we have given the intensity of each symptoms in the proper way. I'm not going to read all of them. I am just going to tell you that this is the case I am doing in a regular manner in my clinic, with the help of my staff, with my junior doctors, and Dr. Saleh Aggarwal, who is a homeopathic pediatrician. So this is how I was doing. All the symptoms were given proper analysis and coming up with the rubrics. These were the rubrics and everything. Now you can just go through the slide whenever you get that, and finally, the repertory is done by the Kent repertory. We got this analysis where the medicine comes, Naxomica, sulfametrum, and all that. But what actually I did? I started with the case with Arnica montana in 50 millisiemens potency, 3 other. So with that Arnica montana, patient started improving gradually. There was a gradual improvement, right? Improvement, patient is going properly into the improvement. You can make out the date, and you will just see that some 1 month time patient was with Arnica, and I reached up to Arnica montana 014. Then what comes? Patient started feeling new symptoms. She started feeling ineffectual urging for the stool and pain, abdomen, everything. Desire to cover, पूरा ढको अपने आप को. And temperament you already see. Now is the time when Naxomica has ripened. And I started Naxomica in olfaction. Properly Hahnemann explained, the olfaction is one of the method of administration of the medicine. So this Nux vomica was very well going on, and patient was very well improving, and I just going with one medicine. I am not giving any other medicine. Only that some point of time, because patient was treated with IFT and all those kind of light electricity pads and everything were used. So some symptoms developed of radium bromide. So I just gave certain doses of radium bromide and back to Naxomica again with the 01. Like this, patient was improving. So, what is the reason of Arnica montana? You must be having a very valid question to ask. See, I told you aphorism 153. The most striking feature and the uncommon feature and the peculiar feature. Nothing to do with the pathology of the case, the cold nose. And lot of massaging, The aphorism 3 says in the end, if the physician knows how to remove the obstruction, the obstacles towards the cure. So that was taken first, and arnica was given, and patient improved. And after a month's time, the proper symptoms of Naxomica, which were there already, they just came up in a very prominent, striking manner. So I started with the Naxomica, and the 29 January 2012 MRI revealed cervical lordosis got straightened. There is a curve in the cervical spine that gone straight before the treatment. But you see, the 7 months, 1 and a means more than a 1.5 years treatment. After that, again the MRI was done, and that cervical lordosis, that curve has reversed. It has come back. That was the report we have with us. So this is a one chronic case I presented to you, and showed you that how exactly I am trying that I should be really following the exact methodology given in the Organon, that I should be following, along with proper whatever the technological support we have, and patients are keen for going for MRI and everything. So everything is being taken for the sake of evidence-based medicine, which is the today's thing, evidence-based medicine. But the best evidence is patient is better, but then along with that internally he is better. That is also to be shown. That was well taken care of. Another case, one 28-year-old lady, she was under my treatment for the various other conditions along with the gallbladder stone. You can understand sometimes what happens, the gallbladder stone of a particular size, 5, 6, 7, 8 millimeter, they enter the CBD and they got stuck. That condition is called colodocholithiasis. So that condition, patient came up in the follow-up that she was suffering with a severe pain in the abdomen. And I immediately got the ultrasound done, and I found there was a stone stuck. That was the time when this chief complained. It is only that short acute condition I am talking about this case. I am not talking about cholelithiasis. I am only presenting with polydocholithiasis. So patient presented with nausea, itching all over the body, weakness in the morning on waking up, along with the colic pain in the abdomen, especially epigastrium radiating to the left hypochondrium. Any pressure on the abdomen was aggravating the pain, and she was with pain, lot of profuse sweating, restlessness, and the intolerable pain you can understand. So, because I was having already all the details of the patient because she was already under my treatment, so I just noted down all those details with us. But the important part is that acute phase I am talking about. So, in the general physical examination, at that very time of pain, jaundice full on, as such, no edema, nothing wrong with the BP, nothing wrong. Temperature was on the little higher side, but still not really high, means no fever to the patient. So, jaundice just came up. You can understand when CBD is blocked, definitely the obstructive jaundice will be developing in the case. So all the systemic examination, those things, everything was done. These are the reports of the patient. We gone through the bilirubin came 3.17. Conjugated and non-conjugated, you can very well understand that conjugated is higher than the non-conjugated. You can understand, you know it very well, the pathology. The most important thing is alkaline phosphatase. Just look at the value of alkaline phosphatase. We should be 280 around, that gone up to 1970, means almost touching 2000. That was the status, which is a very hallmark feature of ALP going such a high value, is the hallmark feature of obstructive jaundice. You know it very well. The CBD is dilated in the ultrasound, 5 to 6 in lumen size, and one calculi is seen in the mid duct. Gallbladder, all wall, everything, सब कुछ ठीक है. But the most important thing is the stone stuck in the mid of the CBD. Evaluation was it. What exactly we understood here, patient was having anger, irritable, obstinate, answering, in an uncivilized manner, very cross, restless, hot patient, desiring cold drinks, spicy, appetite, this, that. Most conspicuous symptom is pain with profuse perspiration. You know, when such symptoms are there, and patient was very very cross in a nature, and rest of the all other symptoms, the very acute and the most striking feature was pain with profuse sweating. That is the hallmark feature of chamomilla. Patients started with chamomilla 01, 02 in a very frequent doses, even a 1 hourly, 2 hourly, like this. It's a case of 2009. And uh, gradually, the improvement started coming. And initially, this jaundice gone, itching better, urine became clear, appetite better, mood, all that anger improved, and stool started passing well. You know, we went for the second LFT test. You see, the jaundice became normal, but alkaline phosphatase has come down to 609 from 1900. Ultrasound. CBD is 3-4 millimeter. Ecogenic sludge, the stone became a sludge in a dependent portion. It is there, but in a sludge form. पत्थर धूल हो गया. Chamomilla is such a powerful medicine. We were still going with the chamomilla only because still all those symptoms were there with him. We went up to 05, 06, and in between, we changed the strokes and we changed the cups and everything. Uh, then we did another ultrasound after a certain time. The CBD is 2.4 no calculus C, you know. And the ALP, the alkaline phosphatase, it has come down to 326 something. So like this, if you want to discuss this case, what exactly we are doing? We are giving a selection of the potency 50 millesiemens. Any case which is acute but at the same time of very harmful, very advancing pathology, that is the choice of 50 millesiemens. And frequency according to aphorism 247. In an acute case, and in advice, even every 5 minutes you can prescribe. Like this, we consulted all the books of our Metromedica, Organon for selection of the remedy chamomilla, potency, succussions, repetitions, everything, everything very well explained. If you get this PPT, you will be able to understand. In sixth edition of Organon, Hahnemann has given the method of using 50 millesimal potency. And in the aphorism 248 footnote, he told how to increase cup, when to increase cup, what is the purpose of increasing the cup. So we just explained everything, in a very meticulous manner to really understand exactly how we did this case with the supporting evidence of the aphorisms from the Organon. If we simply conclude with this case, what we find is that what is exactly the time taken of the symptoms. Pain abdomen went in a day. You can say few hours. Color of the stool, which became white, came back to the normal color 5 days. The jaundice gone away 5 days. Serum bilirubin came normal in 10 days. ALP came back normal 20 days. Status of the stone went off 23 days. So symptom comes first, then pathology comes. Symptoms goes first, then goes the pathology away. This is the timeline, diagram of the case. We can discuss about the whole case, and I mentioned about 152 here, as I just explained you. And if you all must be having your questions, so we can really go ahead with the questions. So my presentations, one part, I am just concluding that organon in the homeopathic practice. You know, practice of homeopathic medicine in one is one. Around the globe, it is one since 1810 till date. And nowadays, the new slogan has come up: one earth, one health. And I added one medicine. 1810 till today, and maybe forever. This has to be the dictum of homeopathy, that whatever may be the name of the disease, whatever may be the condition, if we follow, we give one medicine at a time. This is one simple watchword methodology of practicing homeopathy in everybody's clinic of yours and mine. Definitely necessary upgradation is required. Even Master did that upgradation 6 times, 1810 to 1843. Are we really thinking 7th edition? We should dare to think of. Some may differ, but then I'm for it. Means many people, they can really exactly follow the Hahnemann, that what are the rules and criterias of improving upon, precising upon the organon. So a group of homeopathic doctors can really think of the 7th edition. Now the second part of the presentation is regarding the research, organon in the research. You know, research has basically the two most important component to understand: observational study, experimental study. We all practitioners, whosoever maybe Jola Chap, maybe anybody, maybe a very highly graduated, research oriented doctor. Everyone is doing research, first of all. Some are consciously doing it, some are unconsciously doing it. So, since beginning, since the man came on the earth and started becoming sick and started treating, the first tool of doing practice and research was observation. We name it as observational study. So, second is experimental study. When you keep everything, in uh, knowledge and control, intrinsic within the person, outside the person, extrinsic. All those factors, when you take into account, you're able to see what temperature of the room, what is the temperature of the patient, and number of people are involved, and rules of statistics are used. When you do research in such a manner, which is the recent way of doing research, that is called scientific research, is experimental study. So the before Hahnemann started, working as a homeopathic doctor and came up with the Organon of Medicine, before that, all the research in the medical field was observational but unsystematic study. But Master Hahnemann in the first, he's the first one in 19th century, 1810 onwards, who thought of methodology in medical art in practice and research. So he is the one who gave us the proper observational, rather you can say the systematic observational study in the Organon of Medicine. You know, the prefaces, introduction, it is telling about all the review of literature. It's a very, very important thing in the research work. Review of literature means you have to find out that gray area which is not clear. You want to enlighten upon. That's for which you have to do the review of literature. I mean, what he did, he reviewed the whole literature and the method of treatment, and he found that patient is not getting better. You are treating, patient is suffering. So I need to work on that. So that is what his review. I told you 30 pages. Aphorism 1 and the footnote of 1 is about the ethical considerations for the research, apart from the aim of the research. Then all the aphorisms of doctrinal part, 1 to 70, they are talking about the introduction of the research. And the practical part is telling about the methodology of the research and the result parameters and the discussions and the conclusions. Even in the later aphorism, when Hahnemann is talking about mesmerism and water therapy and all, that he just wanted to clearly saying the limitations of homeopathy and the other recommendations what we can think of. So these are the very systematic presentations by Hahnemann to all of us, improved and precised six odd times by Hahnemann himself. One example I am showing you from the aphorism 145 footnote, where Hahnemann says, you just see the enlightened part, yellow part, the healing art, which then come near the mathematical sciences in certainty. He wanted this, mathematical sciences is maybe the statistical science, or maybe some other kind of higher mathematics, if that can be utilized. But then Hahnemann was well aware about all this. He could not go up to the very meticulous and rigorous experimental research. But the way he did the research, it was nonetheless in any way lesser than the today's very meticulous experimental research. So finally, concluding my presentation, I must tell you that after this lengthy discussion, we must owe to Hahnemann for his work with concrete basis. He never meant it that whatever he has given is complete. We all must proceed to further his work on the guidelines given by him to make it more perfect, more certain to the level of mathematics. You know, definitely we will be able to improve upon the art, and one day its science will be revealed which will be very well accepted in the realm of the science. This can be the true service for the suffering, sign humanity. We all can really do, and we have been doing it. And really, I'm thankful to all of you for all the patient hearing. I would say that let us try and pledge to follow the footsteps of our master. Thank you very much. So many thanks to every one of you. And I welcome all the questions to you now here, if time permits, or my WhatsApp number and my email ID is also on the screen. Uh, you're welcome to ask me any questions anytime. Thank you so much, Dr. Noori. Thank you for giving me the opportunity.
Thank you so much, sir. This was indeed a very thoughtful presentation. There was so much clarity and encouragement for research, especially the mention of seventh edition of Organon Medicine. I hope our younger generation of homeopaths as well as pioneers like you will certainly come up with this idea. The I really have heartful thank you to sir as well as the audience for joining us and patient listening. Please drop your questions on sir's email and WhatsApp if you have any, and also don't forget to join tomorrow's webinar as well on Homeopathy 360. Thank you so much. Goodbye.
Thank you all. Thank you, Dr. Noori. Thank you so much.